Hello, my name is Dr. Robert Arnone. I'm a head and neck injury specialist focusing on the base of the skull and the upper neck, most importantly, where that lower brain stem resides. A lot of concussion, post-concussion syndrome. What I want to talk to you about today is sub-concussive blows. Basically, what that means is hits to the head and neck area, and really it could be anywhere in the body, but commonly that upper head and neck area that maybe don't seem to be big enough that cause a concussion. But see, they actually are cumulative. They add up, they mount, and they matter. So, for example, what happens is someone who's a boxer and they take a lot of jabs, okay? Maybe not necessarily the big knockout, but jabs. So those don't seem to be as bad, but they add up. Or a kid playing soccer and they're heading the ball, boom, 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 heading it over and over and over. Or a kid in pee wee football and in practice they're hitting, hitting, hitting. He doesn't get knocked down. There isn't a big, a huge hit, but there's enough of them and they add up. They matter. These subconcussive blows are cumulative, and either you have things that are constructive or productive that accumulate, or you have things that are destructive, they're bad, that accumulate. So the subconcussive blows are bad. Just like a big concussion is bad, the subconcussive blows are bad too. Now, maybe one subconcussive blow does not equal one big concussion hit, but certainly if you have 10, 20, 50, 100, 500 of the lighter ones, the smaller ones to the head and neck, that can equal or surpass the damages of one big one. Hopefully that makes sense to you. We look at things differently than anybody else, and I've been saying this for the past 20 years that I've been studying concussions. I've had a number of concussions myself, head neck injuries, a lot of health problems as a result. I've been fortunate to find a doctor who specializes in this area and was able to help me. The only person who has those credentials, the proper training, who can truly help you is the upper cervical specific doctor. This is not a neurologist. This is not an orthopedic doctor. This is not a surgeon. It's not an acupuncturist. It's not a chiropractor. It's a upper cervical specific doctor who specializes in this upper cervical spine and puts everything into this to be precise and specific and effective and safe. And it makes all the difference. If you have a problem, or you'd like to find out if your child maybe does, or you need help, reach out to me and let's talk and see if we can help. I'd be happy to look at films and analyze for you to see if this area, which by the way, this is the area where the problem is. It's not up in the head. Even though they'll see, well, because cognitive function is diminished. So maybe answering math questions or specific questions that we asked before, you're not doing as well in the thought process and in the part of speaking it out. So that's going to be higher brain. But what they don't understand is there's nothing wrong here, because when we look at MRIs of the brain, which is slices of the brain, very detailed pictures of the brain, and we don't see anything wrong, we say, oh, it's normal, it's fine. But they're missing it. The actual injury is here at the top of the neck, where the brain stem sits. Through this opening is your lower brain stem, which sends impulses up to the brain. And if that's being choked off, the brain is not getting fed properly. That's where they see the problem, so they think that's where the problem is. That's wrong. The problem is from the source at the brain stem. That's exactly what I focus on. That's what I've been doing for years. That's where the answer is. These subconcussive blows, if there's pressure on that brain stem, these bones are in the wrong position, and we're constantly causing more and more and more injury, even if they seem to be smaller type injuries or smaller type traumas, they add up on top of the problem that's there, and it's accumulating more and more destruction. And in time, you can maybe see eventually brain cells that are dying, or sick or not functioning properly? Sure, because if it's not getting fed properly from brainstem long enough, we're going to see problems at brain that become more permanent. So, we've been seeing it for years. It's changed my life. It's the answer for me. It's the answer for many others. We'd love to find out if we can help you too, or at least answer some questions for you. There is hope. I don't want you to feel like nothing can be done to help you. You just haven't been to the right doctor yet. Reach out to me, put a comment in the box associated with this video, ask any questions you'd like. I can look at films. We're located close to Lambert Airport, and we even have an association with the Haven House, so you can have staying for a very affordable price and shuttle to and from the clinic, and the airport's 8 minutes away. All right, until then, take care and God bless.